So let us start. This is part two of methods and tools to assess food systems with a focus on food environment and food supply chain. I know that Shauna has nicely covered the production and the food supply chain component. And as we move forward, this is a figure which we keep showing you, but I think this is the conceptual framework that we always want to use when we structure our sessions so that we can connect and things do not look disjointed. So, as you can see, we had a good session on external drivers, and now we are trying to assess or use different assessment tools to assess the various components of the food system. And Shauna has already covered the food supply chain. She has covered concepts like value chain assessment and things like that. Today onwards, today and just today only, we have time for this session that I will be covering food environment, individual factors, consumer behaviors, and diets. So, this component and the assessment of these components, however, following another conceptual framework, which is this one, which Shauna had shared the other day, wherein she had captured the two lowest components like 6 and 5, or it is like from bottom up. These are the first two components that we have spoken. We have talked about the supply chain analysis, and we have also captured a bit on political economy, but the group-based modeling and other things will be captured during the last two sessions of this course. But what I'm trying to cover today is a lot, but a primary focus will be given to the food environment assessment, wherein we will be taking account of the concepts which actually affect the food environment and understand the availability, accessibility, affordability of the components of the food system, and how external food environment is assessed, as well as perceived food environment or lived experiences are assessed as a part of food systems assessment. And then part three, or the next part, or the next step, is why is target population eating what they're eating and not eating certain things, and how does that relate to the food environment they live in. So for that, we will be looking at some of the methods like free listing, discrete choice experiments, food-based assessment, and these methodologies will kind of tell us or give us an overview of the different methods and tools that can be used for this step of the food supply chain assessment. And then, of course, these till point three are mostly the exposures. Of course, we would also like to see what people are eating, and for that, we in nutrition epidemiology we use dietary assessment tools, retrospective and prospective dietary assessment tools, which will tell us what foods should food systems make more available, accessible to address the relevant forms of malnutrition. So, in order to understand that individual preferences, what people are actually eating, we will be going through a couple of slides on dietary assessment. And of course, what is the final outcome is the prevalence of different forms of malnutrition in the population, which is usually assessed by the nutritional assessment methods, that is the ABCDs, that is anthropometry, biochemistry, clinical methods of assessment, or biochemical methods of assessment. Sorry, biochemical assessment methods is B. C is clinical forms like clinical signs and symptoms of nutritional disorders. And D, of course, is going back to dietary assessment. Okay, so this is what I'm trying to cover. It's a huge amount of commitment, but what I will be focusing mostly on will be the first two, that is food environment assessment and methods of assessing why target population is eating the way they are eating. And the dietary assessment and nutritional status will be just a very short overview of these two topics. So food environment assessment, now defining food environment. Well, food environment, as we all know, and we have been repeatedly saying this and using this particular definition in several of our slides, which is the consumer interface with the food system that encompasses the availability, affordability, convenience, promotion, quality, and sustainability of food and beverages in the different kinds of food environment, that is wild, cultivated, and built food environments. And when we move across the food system, like the first one is production, then retail, then transport, and then comes the food in the nearby or vicinity, within the vicinity of where we live and we access food from, and how we interact with the food system is what is called the food environment. And it has two different domains, which we have been discussing. One is the way we assess the external domain, what we see, the food market, the ambience, the enabling environment, and so on and so forth, which takes into consideration availability of food, accessibility to food. But when we go to the personal domain, what people perceive about their food environment, why they are accessing certain kind of food. Is it because of the quality of the food? Is it because of the affordability of the food? Is it because of simple convenience that people are going and eating a specific kind of food, or going for ready to eat food items which are freshly available in the market, or going for packaged food? All these are very much dictated by what people think, what is their lived experience. And we are going to tell you or share some of the tools which we have developed as a part of a project, and also tell you about the other sources which have developed, validated these tools, which have not only looked at the external food environment, but the perceived food environment, and then consumer behavior. Apart from accessing the food from the market and why the whys of accessing the food, still there are some more personal attributes which leads to a specific kind of food choice, and we will be discussing some methodologies around that. And finally, we will be also looking at a bit on the food wastage and how to assess food wastage and things like that. So these are the different types of food environment. I won't go into the details. We know what are wild, what are cultivated. How do we get food from kin and community? What is the informal retail sector from where we get the food? What is a formal retail sector like the supermarkets, cooperatives? And there is another section of where we consider, which we consider as a type of food environment, is food aid and services. So the supplementary feeding programs, the public food procurement programs, they somewhat come under the under both the formal food environment as well as the last one, which is food aid and services. Why is measuring food environment important? We all understand that diet is an important determinant of diseases, different kinds of diseases. It's a risk factor. So, poor quality diets are among the top contributors to global burden of diseases. In fact, we know that what children eat and the resulting nutritional status is indirectly related to childhood health problems and illnesses, and can attribute to 50% of morbidity and mortality in children. This is how important is our food. And food is definitely dictated by what we are being fed at home, but also what is available around us. So poor quality diets are an important determinant. Food environments are are driving the dietary and nutritional transition in low and middle income countries. I think all of us can relate to this statement so well. Like, what is available outside? How urbanization, globalization is making a diverse range of food accessible to us, and perhaps a range of unhealthy foods affordable because of their longer non-perishability, because they are being packaged, the additives have been added to them. So these foods are available in the close vicinity. The penetration of these foods are huge, and that has an implication on nutrition transition and dual burden of malnutrition in the low middle income countries. So understanding the dimensions of food environment that are influencing our food choices can help us inform interventions, policies, monitor our food environment, and thereby aim at improving the diet quality. So, what we did as a part of a grant which was awarded to Shona Downs by Imana, and we in India and people from Cambodia were a part of this grant, wherein we tried to develop a complete toolbox of food environment assessment tools which would enable us to measure natural and the built food environment. So the project aimed actually, it has just been finished and submitted. It aimed to develop perception-based, that is personal food environment survey instruments, spatially catering to the low middle income country population. Because the perception, the culture, the lived experiences, the exposure to the food environment is very different, distinctly different from high income community, where the reliance is way higher on the built food environment. Here we are talking about our rural environment, our urban environment, our peri-urban environment, our tribal environment. They are growing, several of them are growing their own food. They are subsistence farmers. They are accessing several sources of natural food environment apart from relying on built formal as well as informal food environment. So we wanted to modify the existing objective assessment of the food environment, that is the external food environment. So we have several tools which are already available and were reviewed for this purpose. And then we piloted these tools and refined them, and refined the food environment toolbox and all the components of it. And finally, we developed protocols for assessing the food environment, and also some know-how videos and some digital instruments also were developed, which were simple questionnaires, which were digitized, or observation checklists, which were digitized to be used in different setups. And the protocol also told about where to use which tool, depending on the research question, which tool will suit the best, which tool would need modification. So all those were put into a complete package of food environment tools, assessment tools, which could be used by low middle income country population. I will share a link of the entire package and the tools at the Pedlet platform. And I would encourage all of you to go through the tools and come up with questions and come up with suggestions of how these can be improvised, used, or maybe validated in different country setups. So what did we do? We did a Delphi survey to refine our perception-based personal food environment tool, which was developed from scratch. We did expert workshops. We did cognitive testing of the tools and pilot tested them in both India and Cambodia. The approach for developing and refining the tool was that for the food environment toolbox, we identified the existing survey items, like specific questions were picked up from the other tools which were trying to gauge food environment from a lived experience perspective. Then we made a wish list kind of a thing with all the questions incorporated and presented it to the experts, who then reviewed the questions in the tools. And through Delphi survey, we did a consensus building exercise. We did the cognitive testing of the tools, of the tool. Then workshops were convened with food environment experts, and after their comments being incorporated, the tools were piloted. For the external food environment, on the other hand, we reviewed the existing tools that are available, and these included the USAID market-based food environment assessment tool, the cost of a healthy diet tool, then the Eat Safe vendor observation checklist, the environment profile of a community's health, the EPOC tool, the multi-sectoral food and nutrition security project in Cambodia, and the International Network for Food and Obesity and Non-Communicable Disease Research Monitoring and Action Support, INFORMAS. You must have heard about this INFORMAS modules, and of course, the World Food Programme's Market Functionality Index. So several tools were reviewed, and based on that, we have now put together a basket of tools which can be used to do the assessment of the external food environment. And of course, the iterative process was used in refining the tools, piloting the tools. And some of us who are attending this course have been a part of this piloting, and a huge thanks for that group, because they were instrumental in these iterations that were carried out while we were piloting the tool in India. So the food environment types and dimensions assessed in this toolbox are: number one, for the perceived food environment, that is lived experiences, we developed this food environment perception survey, which is a quantitative tool, and we also did a participatory mapping. Participatory mapping, as we all know, or social mapping, has been conducted as part of several ethnographic studies and other studies wherein we try to understand and give a structure to the food environment which the community is accessing through a focus group discussion. I'll be discussing it more. And as you can see, the dimensions or the types of food environment that were assessed through these tools and the dimensions of food environment that were assessed through these tools. Now, as you can see, all the types and all the dimensions were assessed using the perceived food environment tools, whereas for the objective food environment tools, which were assessing the markets, the community food environment, the markets, the vendors' perception about the food environment, a seasonal calendar to see the seasonal availability of different foods in specific food environments, the cost of healthy diet to understand the affordability of the current food basket and developing a healthy, affordable food basket at the minimum cost while considering the food-based dietary guideline is the cost of a healthy diet tool, which has already been developed by the other groups and all, and we sort of incorporated it into the food basket. And we also tried to use a tool called Pro Desirability tool, but we're not successful in using it, especially understanding the diverse food environment that exists in low and middle income countries. I will be discussing about it in bit detail. So now if we look at the toolbox and the level of data collection, so at the individual level and at the household level, what are the tools that we are using? We are using the Food Environment Perception Survey, wherein we go and do some individual surveys. Then the in-depth vendor assessment is used in the immediate environment of the community, that is the market environment, wherein we go and talk to the vendors about the food that they're selling, why they're selling, what are the factors, and things like that. Then at the market level, that is, we go out and go more, it will be more like a community level kind of a thing. We do market mapping, market properties, infrastructure, market vendor rosters, market promotion, and things like that. And lastly, at the community level where people are living, where where are the food sources located? Is it across the street? Is it within the village that there are some food outlets? Are roadside vendors coming and selling foods? And also at the community level, we are collecting some data on the food prices. And of course, the participatory mapping and seasonal calendar is also done at the food environment, at the community level. So this tool is a set of 7 tools, and these 7 tools are administered at various levels, at the individual level, at the vendor level, at the market level, and at the community level. Most of the tools in the toolbox are used at the market and the community level as they are assessing the external food environment, whereas at the individual and the vendor level, we are at the vendor level also for that matter, there are some tools which are assessing the external food environment, but the personal food environment is assessed at the community where we are doing the participatory mapping and at the individual level when we are doing a survey. Now, I'll take you through some of these tools. Now, as you can see in the picture, the team is sitting with the community, the key informants in the community, with some gender distribution, and of course, those people who are responsible for procuring food from the market, as well as those who are responsible for producing food, which is available at the backyard or in the fields. So in this participatory mapping, we sit with the community and collectively develop a map of the community's food access points. And also, if we now look at what are the research questions this participatory mapping tool is trying to answer, we are trying to see what are the different types of food environments that the communities access for food, where and how they acquire different kinds of food, and how does the food access and how has the food access changed across time and season. So some historical information is also gathered during this participatory mapping, wherein we ask that how has the access to the natural food environment changed? What is the percentage reliance on the market food environment or the built food environment? How do you access the built food environment? What is the mode of transport? So all these generic questions are asked, which sort of informs us or takes us ahead, takes us or informs us in utilizing the rest of the tools that are available in the toolbox. If the community says that they are just accessing markets and all, and they are living in the urban food environment, perhaps seasonal calendar does not find or is perhaps not of much importance in that community where things are available perennially through the market. But what we found was we did try and use the seasonal calendar in the urban environment also, and there is still some component of some component of seasonality existing in the urban food environment, but that has actually changed drastically during the past few years because of better post-harvest technology, better supply chains, and availability of several foods have become perennial now. So, a kind of understanding the overarching food environment, the types, and then going ahead with selecting the rest of the tools for the purpose of addressing the research question of a study. So the participatory mapping tool, the objective is to assess types of food environment that the community has access to and to guide us in selecting the tools to be used from the food environment toolbox. What kind of food environment are we, or what is the dimension of the food environment or the domain? It is the perceived, that is, what people understand about their food environment and what they have to tell us about. So it is totally perception based. The dimension of food environment, we are looking at availability, affordability, convenience, sustainability also for that matter. Like, do they think or perceive their way of growing food is optimal in terms of its environmental impact? Do they think that the children are still learning the skills and all? So all these questions are also covered under this particular tool. It is administered as a focus group discussion, and target group are usually the primary shoppers for the household and the people who are actually growing food at the household level. Method and time, it is sampling is purposive. We want to target specific people who can give us a good information about the food environment, and it is using FGD, and it takes time. It takes around 1 to 1.5 hours. Then is the seasonal food availability calendar. This is again administered through a focus group discussion, and this is a rural area in India, in Madhya Pradesh, India, where we were administering this tool. What research question does this tool answer? How does food availability vary across season? And I'm sure those who are working in food systems have used this tool, and this has been used in the past also to understand the different attributes of seasonality in a nutritional status assessment, in nutritional intake assessment, and also availability of food across the seasons. So what are the main sources of different foods and what have been the changes in food availability over time? Again, objective is to assess the seasonal availability and any perceived changes that have happened in the seasonal availability. So the climate part of it, the sustainability part of it, the food, and I'm talking about climatic sustainability. We are not looking at the economic sustainability, but yeah, social and climate sustainability or environmental sustainability is something which we try to capture through this seasonal food availability calendar. The food environment that we are assessing, wild, cultivated, and built, dimensions, availability, and sustainability. And it is administered again through focus group discussion, and it takes time. Overview of the external food environment included in the food environment toolbox. Now, the first two, as I said, first three, in fact, were administered and were perceived. Now we look at the objective assessment of food environment. So under this, we have the community food environment mapping tool, the market mapping tool, the in-depth vendor assessment tool. This is also an observational tool, by the way. It is not the vendor's perception, but we just go observe what the vendor is selling, what are the foods that are available, and sometimes ask a few questions to the vendor if that is not observed in the specific shop that we are assessing. And then we have the cost of healthy diet data collection protocol for primary level data collection on food costs. It's more or less like a market survey, which kind of informs the cost of healthy diet tool. As we may know that cost of healthy diet tool uses secondary data also and primary data for collecting the food prices and then developing a healthy food basket, which could be which is in line with the food-based dietary guidelines and provides a minimal cost, which will be incurred to develop such a or it is an optimization exercise that sort of tells us that at this cost you will get a healthy diet in a particular region, area, country, or specific locale. And then there is this PRODES tool, which I'll be just touching upon a bit. So community food environment mapping, this picture is from Cambodia, and where we are just moving around in a village or an urban area wherein we try to map the different food access points that exist. Most of them are informal and formal food access points. So which research question does the community food environment mapping tools answer? Well, it answers which type of food outlets and mobile vendors do consumers have access to, and what types of foods are sold and promoted. Promotion is an important thing because that actually influences our food choices. So several of our tools are trying to capture the promotional aspect. So the community food environment mapping tool, the overview, it tries to assess the types of food outlets and mobile vendors that consumers have access to. So I want all of you to visualize what is community food mapping tool and how it is different from the market mapping tool. Community food environment mapping tool means that where I'm staying in my immediate vicinity, what are the various food access points? There could be a mobile vendor which is coming and selling fruits and vegetables. There could be a small corner shop or a tuck shop which is situated, at 2 minutes walk from my house. Or there could be a person who comes on a monthly basis and sells some produce from his farm and we buy it from that person. So that is where we are coming from when we are talking about community food environment mapping. Whereas a market mapping tool will be a proper market which the community is accessing. It has to reach out to that market to access food from there. Okay, so please understand the difference between the community food environment mapping and the market mapping. The objective, as I said, is to capture the types of food outlets and mobile vendors that the consumers have access to and the quality of food sold and promoted within them. Of course, it measures the external built food environment. Built could be formal or informal. The dimensions would be availability, promotion, quality, and also affordability. Affordability is not much captured, like we are not looking at the food prices in this tool. And it is administered by the field investigator. And the target group is basically visiting all food outlets and mobile vendors in a predefined community boundary. So sometimes this community boundary can be set by physical mapping, or sometimes people have used innovative methods of GIS to understand the boundaries of a community and then mapping the food access outlet points. What we are trying to develop as a part of another study, which is the Karishma study, is we want to actually map these food access points using GIS mapping. Like we can just see if it's a subsistence farmers community, we can see the farmlands which are existing, the kitchen gardens which can be. So, GIS mapping can be very interesting in developing not only developing the boundaries of a community, but also identifying specific food access points. And the method is like a census of all food outlets and mobile vendors. Method of administering is an observation checklist, and you can use a tablet for that or a paper form. And the time taken depends on the size of the community and the density of vendors that are located. I'll stop. So, what is included in the community food environment is a food outlet census. So, just take an example. You go to a huge locality. For example, it's an urban locality. Suppose it's block E of a particular locality, say Sarita Vihar, block E. So, that is the community if you are considering. Then, there you will first look at the entire community, set up your radius or the circumference of that community, and within that circumference, you will go and start listing, do a census of the different food outlets that are available. Okay, and then you can look at the roadside food and beverage promotion messages that are there, and the tool sort of lists those. And then we have a mobile vendor census tool. As I said, in a community, there is a vegetable vendor who's coming, there is an ice cream vendor who's coming, and things like that. Another important point which I want to reiterate here while we are mapping the food environment is the food groups that is used as a part of this tool. And we literally struggled to, define these food groups because all the tools need to map food items using a specific checklist. And what is that checklist? Do we use the minimum diet diversity score, or the GDQS, the Global Diet Quality Index, which uses a food group classification? So this food group classification, tailoring to low middle income country, was a huge iterative task that we had undertaken. And finally, we had come up with listing the foods both while considering not only the MDDW, but also the NOVA food classification, which classifies foods in terms of their level of processing, because the healthiness also goes down as the level of processing increases. So we did consider that. And as you can see, from number 1 to number 8 are all unprocessed or minimally processed foods which are available in their raw form in our markets. Like, we have to minimally process rice. We cannot have rice with the outer covering, and the of course bran is good, but the husk is not edible. So, all those foods are minimally processed, but they are similar to unprocessed food. So they are all put together. Then we had processed meats because WHO has strong recommendations against consumption of processed meats. So we have put them together, and some of the ultra processed meats are also there in that group. Then we have the vitamin A rich foods, then the dark green leafy vegetables, other fruits and vegetables. Why processed meat was put here? Because this was coming in continuation to some of the unprocessed foods, and processed meat is a kind of food which is consumed quite extensively in some of the low middle income countries, like smoked meat, dehydrated fish, and what else? Salted fish and stuffs like that. So all those were put together. And please understand that this tool was not developed only from the nutrition perspective. It was more developed from the food systems perspective, like what people are getting exposed to in a more broader sense rather than going nutrient wise. But of course, vitamin A rich food items were given a separate classification, and this is the case in GDQS also. Then we have the different categories. As you can see, these are all till 15. We have mostly unprocessed foods, but when we move on to edible oils and fats, we have created subcategories and have put the different sources of fats in terms of their health benefits. So animal fats, plant oils, and hydrogenated fat, as we know, is rich in trans fatty acids and all, so have been put under a separate subgroup of edible fats and oils. Then definitely sweets, because we know sugary foods are considered a health risk for non-communicable diseases. And then we have classifications for ultra processed foods which are available, the sweet drinks, prepared foods by street food vendors and restaurants. Like, we could not put this food group under anything like ultra processed because they are not ultra processed. They are processed, but processed by somebody else outside, and somebody else is using any kind of oil, fats, sugars, and all. So we had to put them as a separate category. And then there are condiments, spices. And in some of the low middle income countries, we found that the food environment was openly selling alcohol, and alcohol promotion was very common. So we had to put that as one of the categories. And of course, bottled water, fortified mixes, and all are put as optional categories, which a country may or may not use based on their food environment characteristics. So the food outlet census is a part of the community assessment tool. And what are we doing? We are just looking at the food outlet types, we are looking at the food sold, and the promotion of foods and beverages in those outlets. Then the data from this tool allows us to spatially map the food vendor types in the community as well as the foods that are sold and promoted. This can provide insight into gaps in food availability as well as degree of abundance of unhealthy foods. And I think all of you can visualize the corner shop which is there in the locality, which is selling all those packaged foods which are displayed in a very colorful manner and which is actually affecting the food choices. It describes the quality of food sold at the food outlet. Roadside vendor, it is, you can understand what I'm talking about. Then mobile vendor census. So this is one of the field investigators who is just sitting in a village in Cambodia and just waiting. And he's doing his work, sitting at a point and just counting the number of mobile vendors that are passing by and then observing the kind of foods that this mobile vendor is selling. Okay. A key location or a thoroughfare is selected where the enumerator is sitting and is sitting and is I'm so sorry, and observing the vendors who are passing by. Then comes the market mapping tool. So from the community, now we move on to the market mapping tool. Which research question does the market mapping tool answer? What are the market properties and infrastructure? This is important because this is important from the hygiene for washing hands and washing stuffs and all, and other basic amenities around it. Then, which type of food vendors do consumers have access to in that market? So, the different types of shops and all. What type of foods are sold and promoted within the market? The market mapping tool sort of assesses the market infrastructure, types of vendors, the consumers that have access to the market, and the quality of food sold and promoted. It, of course, assesses the external food environment. It provides information on the dimensions like availability, promotion, quality. It is administered by a field investigator, and the target is the overall market and a census or a subsample. So sometimes we found that the market census was a difficult job if the market was huge. Then you have to use a kind of a sampling technique wherein you pick up samples or specific geographies either purposively or use a statistical method to identify specific clusters within the market for assessing for doing the census. Sampling is important and observation is through a checklist. Then comes in-depth vendor assessment. Now that you have seen the market, you've done the census, what's next? The next is to sample different kinds of vendors and see what they are selling. And which research question does the in-depth vendor answer? Which food or food groups does the vendor sell? What are the sustainability and the labeling properties of the food? This is more applicable to vendors who have packaged food items. Okay. What are the safety and hygiene properties of the vendor, like presence of water, if the flies are there, and you can clearly observe that things are not kept hygienically. So all those questions are there in this checklist. How are the different food groups stored by the vendor? Storage. And what type of food and beverage promotions are present with the vendor? Like you enter the vendor shop and you see a big, huge ad of buy one, get one something. So those are the important ways which sort of influence food choices. And this is specifically important if we are looking at some unhealthy food choices which are being sold. Then the in-depth vendor assessment overview to assess several food environment dimensions in a subsample of vendors, food outlets in a market or in the community. So you use the same vendor assessment checklist for the shops and other outlets within the community as well as in the market. It measures external and built food environment. The dimensions captured are availability, promotion, quality, and sustainability. It's administered by the vendor using, food field investigator using a checklist. Another important tool which I just thought of sharing with you here, and our work was actually inspired by these works, is the Eat Safe module, which was a 5-year project funded by GAIN. funded by USAID and I think implemented by GAIN, which actually developed a kind of a, you know, a complete package of intervention, but first understanding the market dimensions, modalities in a traditional food environment, and then sort of giving solutions which are drawn upon from the community where the intervention needs to be given. So I've just given you a screenshot of a vendor observation guide, which is a part of this particular complete package of not only tool but also intervention. And there are interesting papers from this group, and you can actually look at their assessment tools to look at the specific dimensions related to food safety, which are nicely captured in this tool. Another work which I wanted to share with you is a work which we have done with World Health Organization, wherein during the on the World Food Day, we got a request from WHO to develop a set of tools and to administer it to a set of key stakeholders who are an integral part of the food supply chain to understand their knowledge, attitude, behavior, practices regarding indigenous food standards to ensure food safety and quality. So, what was the first thing we did? We just looked at the key actors in the food supply chain. So, in the pre production level, we understood that those who are making policies, who are executing policies, are key players. At the production and processing stage, we looked at the food industry, the food service establishments, the food handlers, the street food vendors as the key players. In the post processing stage, we also looked at the retailers, those who are having supermarket owners and the grocers and people who are also selling raw food items. And some of them are running little parallelly. And of course, at the consumption stage, we use this KBP survey at the consumer level. So we sort of profiled these stakeholders and covered several thematic areas. We looked at the food safety surveillance, safe and nutritious food, food additives, food safety and quality, audits, inspections, and other knowledge and attitude and practices around food safety and standards. The other thematic areas, as you can see on your screen, I'm not going to go through them, but when we reached at the food service establishment level, we also looked at specific apps that have been developed by the Food Safety Standard Authority of India, the knowledge about those apps, the knowledge about those rules, regulations, guidelines, and their implementation by various stakeholders. For food handlers and street food vendors, we really focused on the hygiene aspect of it, the food safety aspect, and training was a common thematic area which was covered across all the stakeholders and actors of the food supply chain. And then for retailers again, we wanted to look at the food storage provision, first in, first out principles being followed or not, safety, hygiene. So all these questions are listed, and I'm happy to share these tools. We have developed a policy brief for WHO, which I will be uploading at the Padlet platform. And of course, at the consumer level, we looked at hygiene, safe food preparation, access to food, food label reading, because this has come up in a big way in our low middle income communities, wherein labeling and front of pack labeling is being emphasized as one of the important initiatives and interventions for informed food choices. But understanding the literacy of the audience, semi-literacy, how we can make these labeling user friendly is something which is being contemplated in India, and so is, I'm sure, is the case with other countries. Then the cost of healthy diet data collection protocol. So the research question is clear that how much does it cost to obtain a diet that satisfied food-based dietary guidelines? And the objective of this particular tool is quite extensive in terms of it assesses the cost of diet that satisfied food-based dietary guidelines, and it uses a lot of secondary data. The food environment, of course, assessed is the external food environment. Affordability is the primary concern. But we had just piloted a part of this, which was the primary data collection, wherein the vendors who are selling key foods in the markets were approached and we checked the prices of the food. So a market survey was basically used for this particular purpose. Then comes the food environment perception survey. Till now, we were discussing about all the external food environment objective assessments. Then comes the perception based tool. And which research question does this answer? This answers where are people accessing their food from and why and which food are they accessing. How do people perceive the different dimensions of food environment like food availability, affordability, convenience, quality, promotion, sustainability, and how do the different dimensions of food environment influence their food acquisition. So food environment perception survey has all the domains covered, covers all the types of food environments, and lastly, administration is done through a survey at the household level. It takes around 45 minutes. Then comes the next step. What the figure that Shauna had shared with you, it had the third, sixth, fifth, fourth was food environment. The third one was why target population is eating or not eating some kind of food in relation to the food environment. So this is coming at the level of consumption. Till now, we were talking about procuring, why they are accessing, what are the factors of accessing those foods, the quality, the convenience, the safety. Now, why people are eating the way they are eating and its relation to food environment. So, for this, ethnographic methods have been emphasized a lot in the literature. What are ethnographic methods? Ethnographic method or ethno means related to the study of different societies and cultures. So this is more a sociological part. And I feel any nutrition and food systems research is not complete unless if we are not making it contextual. And to understand the concept, I think ethnographic studies are very critical. Ethnography consists of the processes and products of research that document what people know, feel, and do in a way that situates the phenomena at specific points in time in the history of individual lives, including pertinent global events and processes. So, this is a very broad definition, but please try to link it with our food environment assessment or food systems assessment. Why people are eating the way they are eating? Are there connotations to it? Are there social connotations to it? Some religion in India, for example, some religious groups will eat certain kinds of food and will not eat certain kind of food. So we cannot have a policy which is not sensitive towards that. And how can we be sensitive towards that until and unless we study those dimensions of food systems and consumer behavior, and then tweak our policies accordingly. So this is where we are coming from, wherein we cannot we want to introduce a certain kind of food. For example, we want to introduce milk, which is a high value protein in children's feeding program. But we go to a tribal community where we are working and we try to do an ethnographic study and understand why people are eating the way they are eating. And the community tells me that no, we don't drink milk. For us, milk belongs to the animal and it's calf. So if it is a cow, it's a calf. And if it is a goat, it's a kid. So we don't drink their milk. And then in the school feeding program, if I want to introduce milk, will the community be accessing that milk? And then we will say that, oh, we did so much of effort, we spent so much of money in introducing milk to that community, but the community is not accessing it. So there, perhaps egg is a better option because they are usually eating animal source foods, but not milk. Okay, so understanding the context, understanding the socio-cultural milieu in which we are working is very critical, and that is where ethnographic studies can be of a lot of importance. Ethnography and public health nutrition, well, they are very well connected. And when we are talking about public health, nothing, there is a phrase which is like nothing about us without us. So you have to take the community into consideration, their beliefs, their practices into consideration before making any kind of public policy. And this is where we talk about co-production, co-designing, co-development, community engagement. All these come into picture, and using ethnography and public health nutrition principles is of utmost importance here. We cannot go with our own biases that, oh, this is a tribal community. I've read a lot about the tribal community and they are this and that. No, we have to talk to the community to get their perspective about themselves. So, in one of our studies, we are working with one of the tribal groups, and the first question we are asking, how does it feel to be a particular kind? I should not name that community, to be a particular community. And sometimes the community is not able to link that question. So, we are simplifying that question and asking, so what are the ways of life of your community? What have you learned from your elders? So, all these questions are very critical if we are trying to plan any kind of intervention. So the data collection techniques, like in ethnographic methods, we can have open-ended interviews, in-depth interviews, participant observations, and focus group discussions. And the focused ethnographic methods include social mapping, like we have done the participatory mapping, photo elicitations, free listing, pile sorting, rating and ranking, and paired comparison. We have used the last four in our work with the indigenous communities of India, but I'll be taking you through this method of free listing, wherein we ask the participants, we start with a question or a set of questions that elicits series of items. It could be an object, it could be a food, it could be an event, it could be an issue in a cultural domain. So, for example, the question could be list all the X or all the foods that you consume in your community, and what are those kinds of food? And then there are probing questions like, where do you access these foods from? Are these foods native to your land? All these questions will sort of give us a free list of all the items that are present in a specific domain which we are trying to assess, and come up with all the possible examples that could exist in that particular domain. This is followed by saliency mapping and prioritizing, pile sorting, pairwise ranking of different stuffs, and prioritizing the foods which can be a part of an intervention that we are trying to plan. So free listing sort of gives us a very gives a cultural connotation to anything that we are listing, an issue or something in a community. List your favorite food, discuss the similarities and differences in your list. These are some of the questions. Strengths and limitations. It's a simple and rapid technique. It elicits local terminology used to describe a particular domain. It reveals cultural context, and it helps us compare different groups, quantitative and qualitatively. Limitation is the number of participants. The number of participants depend on the homogeneity and the number of groups and familiarity with the domain. Some domains are not easily listed, which are called the fuzzy domains, and requires more probes and prompts. And there are different ways of, difficulty in cleaning up the synonyms and stuffs like that. So once we do, you will come to know, but we have extensively used this in our indigenous food study. Then we have another interesting method, which is called the discrete choice experiments, and economists use it. Pharmacological experts, or those who are working on willingness to pay for vaccines and stuffs like that, have used this extensively, but it can be used in food systems research as well. It's a method of stated preference assessment that uses a survey to ask individuals to make choice between the two options. Responses are analyzed Responses are analyzed using statistical methods to quantify respondents' relative preference. I'm just reading out the methodology. Once I give you an example, you will understand what I'm saying. The methods like discrete choice experiment, best worst scaling methods can be used to better understand the drivers of food choices. And sometimes researchers use a mixed method to understand the relative importance of the preferences, for example, for different diet quality attributes like nutrition, food safety, price, convenience. So these are the different domains or different measures based on which different food groups can be assessed. And that might then influence our food choices. I'll give you an example, then things will be clear. These are interesting articles which you can read, like one of the articles, which is Beyond Price and Income Preferences and Food Values in Peri-Urban Vietnam. So here, women were randomly selected and were interviewed using a specific scale, which was the best worst scale, to elicit preference among food quality attributes for different food groups. So there are different food groups, as you have seen. So you could have food group of interest, green leafy vegetables, protein, high protein foods, milk and milk products, cereals, and all. And then the women are actually asked about a subset of these women using a focus group discussion are asked to explore their preference and food values in more detail. The food quality attributes, then they say, okay, for milk, what is your primary this thing priority when you select milk? Is it the food safety? Is it the price? Is it the quality? And the person might say food safety because milk can lead to different kinds of diseases. So I would definitely make quality much higher than the price. I won't prioritize the price. I will pay any amount to buy milk of good quality. On the other hand, if it is green leafy vegetables and they say, oh, it's so cheap, I can manage, it's so easy on my pocket, and I have, this is the easiest thing I get in the market. So I would just see if this particular green leafy vegetable is cheap, I'll buy it. Even if the quality is little poor, I won't mind. So all these, they are making some discrete choices in their decision in order to buy a specific food group. And that sort of informs what people will select if we do some kind of an intervention wherein we change the dimensions or change the food types or food groups and make it available to the community. So this method has been used in other studies evaluating consumer preferences for healthy eating from community kitchens in low income urban areas, a discrete choice experiment. There are several studies on this, and to understand what people eat, why people eat, what they prioritize while selecting something to eat, we have used these methods. Then we also use matrices to report food waste. For example, sometimes in schools and all, you can just look at the plate waste and see where is the preference going. The kids are finishing the cereal first, and then fruit is the last thing that they're finishing. Or a packaged food which is served is finished first, and then if they are still hungry, they would go for the fruit. So that sort of informs us about what people are prioritizing. So this is about the metrics used to report food waste. And this is how we can just directly weigh the food. We can do in-person visual estimation, and we can also do digital photography. Then process for measuring food waste. There are two ways, weighted method and visual estimation. At each school visit, 3 sample states are weighed and with both food options to determine the pre-consumption measures. And after school children finish, you look at a trained researcher measures and you can read it. It's a very simple method, but it's a tedious method. Then the last two sections are which foods should a food system make more available, accessible, affordable, etc., to address relevant forms of malnutrition, and which ones less do. So, like we have to make certain foods available and we have to restrict certain foods, or restrict in the sense make it less accessible, and or in other words, the studies or the interventions on food taxes, sugar taxes, and all. Why are those policies being made? Because we are seeing that sugary drinks are an instant source of energy. It's good to our palate, and people are consuming it. It's easy on your pocket. So, if we want to make fruits and vegetables more accessible and affordable to the people, we must understand whether they are loving it also or not. Are they not eating vegetable because they are expensive? Are they not eating fruits because they are expensive? Then the fiscal policy has to be made accordingly and tailored to the requirement of the population. But for doing so, we must first understand what does the community actually eats. And for that reason, we do dietary assessment. But Dietary assessment is a very complex exposure to measure. It is important to have a clear-cut research question in which exposure and outcome are clearly defined. You can't go into a very granular 24-hour dietary recall when the purpose is to understand the quality of the diet the community is eating. So perhaps you have to have a very condensed food frequency questionnaire, or maybe another proxy of food frequency questionnaire, maybe a diet diversity score where we have specific food groups and just assess. So you have to have a clear-cut research question and then use the dietary assessment method accordingly. It aims to measure the relevant exposure with required accuracy, and the study design should be considered in the light of theoretical and practical consideration. Dietary assessment studies are complicated. You need specific expertise in nutritional assessment, databases, and all to get into this kind of studies. Country specific databases are very critical. Nutrient retention factor being considered or not in the database is critical. So these are very important things. Food consumption can be measured at the national level, so you can use proxy data or secondary data to assess food supply chain, and then supply and production, and then divide it by per consumption unit. This is a secondary way of doing it. And then you can do food consumption at the household and individual level. There are different retrospective and prospective methods. I'm just rushing through these slides because I need to keep some time for discussion. And I'm not going to explain all these methods for sure, because this is not a part of this particular discussion. But if you need additional readings and all, I'm happy to share these with you. Okay?
Suparna, there is a question. Can
Yes.
I just?
Yeah,
Yeah, it
sure.
says, I was just curious to know what was the cost of a healthy diet that emerged from the research conducted, the one Jessie was talking about.
Okay, so again, I must reiterate that the cost of a healthy diet is a tool that we were trying to not validate, but trying to supplement it with a market survey. This study aimed at developing the tools and not conducting research using the tools. So we did not use this cost of healthy diet, but having said that, there is a complete website which has all the data, country specific data. And if you're keen on measuring the cost of healthy diet of a particular country, there are data sets also available for those countries. And by complementing it with primary data, you can actually calculate the cost of healthy diet for your region, nation, and all. So I can share the email, the link to that website, and the email of Professor Anna Herford and her team, who could help you to do the calculation. So our work was not to use this tool to calculate the cost of healthy diet, but to validate or to pre-test a survey tool to complement the cost of healthy diet tool. Is that clear? All right. Any other questions?
None as of now.
Okay, so this is the last section, and again, just 2 slides. Finally, if you go to the top, that is the prevalence of underweight, wasting, stunting, overweight, and micronutrient malnutrition in the target population. There's a question mark missing. So what do we use? We use different nutritional status assessment methods to, assess this prevalence. So as you understand, our lecture was on methods and measures to use for going across the food systems assessment that would then in turn inform any intervention that we are planning. So once the intervention is rolled out, or to monitor the intervention, it is important to assess the nutritional status of the population on whom the nutritional or the food systems intervention was implemented. And for that, what do we use? I have several nutritionists in the group, and they are all aware of the A, B, C, D of nutritional status assessment, which includes A for anthropometry, B for biochemical assessment, C for clinical assessment, and D for, the dietary assessment. So nutritional assessment, why do we need it? We need to identify nutritional factors affecting person's current and future health, may want to measure success of an intervention, or identify people at risk of malnutrition. So A, B, C, D are these. So these are pictures from the field wherein we are doing some anthropometric assessments. For clinical assessments or clinical signs and symptoms, this is a picture of a bite or spot, which happens because of vitamin A deficiency. Here is one of our colleagues who is doing at field level assessment of biochemical assessment by taking finger prick samples for assessing nutritional status. So, and I would like to conclude with this particular why, we must, as food systems researchers and nutritionists, understand the sequel of events that happen, which finally leads to nutritional disorder in clinical forms. And our assessment of nutritional status should be informed by this sequel of events. If we are giving a food systems intervention for 6 months, and we are trying to see if the clinical forms of malnutrition have been taken care of, well, it is too much to expect. You can only look at how diets have changed. Or if you have given an intervention for 1 year and you want to see if stunting has reduced in a population, well, I would request the food systems researchers to be realistic in identifying what indicators to take based on the time of exposure and understanding what it takes to translate a nutritional or a dietary insult to precipitate into a clinical form of malnutrition. So the sequence of events leading to nutritional disorder in clinical form can be assessed, number one, when there is primary dietary inadequacy or secondary conditioned inadequacy. So either ways, there could be an insult which is happening in the diet. So what can we do? We can just quickly take a dietary recall and understand, is the population at risk of dietary deficiency? Okay. Or if you have given some kind of intervention where you are changing the markets, you're changing the food plate, and want to quickly see people are eating or not, do a dietary survey. When the insult happens for a long period of time, then the tissue saturation gets affected, which can be reflected in our urine, in our biological samples. That is when we do biological methods and hematological assessments. So when you want to study something in depth and want to understand that how come so much of anemia is there in the population, that means the woman has been eating a diet which is not having enough iron sources and has several other underlying causes such that her hemoglobin is showing a low level. So, the sequence not only tells us which tool to use, but also tells us which all tools to be used to understand the problem in depth. Okay. And then when the tissue saturation is affected, it leads to biological lesions and the growth is also hindered. So when food insult has happened for some period of time, that the first thing we will see that the child, in case of a child, the child is losing weight. So weight for age is a quick indicator, both acute indicator of acute nutritional insult as well as chronic, because somebody who's stunted is also underweight. So, after the dietary insult has happened for some time, that is when we see growth retardation. And finally, when you see clinical signs and symptoms like you see flaky pain dermatitis in child with a severely acutely malnourished child, or you see a skin manifestation of pellagra, that means the diet has been low in that particular nutrient for a considerable period of time. And that is when these clinical signs and symptoms have occurred. So to cure that, we have to first replenish the diet. And then some of the changes are irreversible also. So we must understand the granularity of this sequel before deciding on the indicators for assessment of nutritional status. Or in other words, keep things complementary. Like you do a dietary assessment and then you do an anthropometric assessment also. And try to correlate the two methods, correlate the two to see the long-term impact of diet on another assessment method. The sequence sort of tells us how nutritional insight leads to clinical forms of malnutrition, and at different stages, how different nutritional status assessment can be done. So that is it from my